The Sisonke Booster 2 trial will begin today for the more than 500,000 healthcare workers who took part in the study. That's after healthcare workers became the first tranche of South Africans to receive the COVID-19 vaccine. That was back in February of this year. So the study will collect data on how long the first dose of the Johnson & Johnson vaccine lasts and when a booster shot is needed for the general public. Let's unpack it all for you now. Professor Linda-Gail Bekker is the director of the Desmond Tutu HIV Center and the co-national investigator of the Sisonke study. She joins us now via our video link. Prof, it's great to have you with us on the program this morning. A bit of a technical glitch with the Sisonke 2 booster study. It was actually meant to kick off yesterday.
Correct. So in the test drive yesterday, because SMSs have to go out, we noticed a mistake. That has been corrected and the SMSs will be going out today. And vaccinations will be able to start as soon as people receive their voucher and come with the voucher in hand with their identification to pre-accredited vaccine sites. And we're also publishing those sites today so people know exactly where to go.
So it's for the people who took part in the first part of the Sisonke study. That was back in February of this year. So it's been how many months now? It's been about 8 or 9 months. Is this on track for what you would have predicted the booster for the Johnson & Johnson vaccine would be?
So we're obviously following what's happening in countries to the north of us who have been vaccinating for much longer. And many people will know that in those countries there is a move now to boost healthcare workers and people who are older or people who are immune compromised. Because our Sisonke participants, most of them frontline healthcare workers, have been the longest vaccinated, we thought that it was very important to follow suit and make sure that they get a top-up in their protection ahead of a potential fourth wave. So that's exactly the reasoning behind moving forward with this boost. It is also to try to understand better what the value add is and how things pan out differently for those people who accept the boost and those who don't. It's entirely voluntary, so people can choose if they wish to do this or not.
So even if the booster shot for Johnson & Johnson is rolled out to the general public, and I suppose that's a consideration that's still a long way off, given the fact that we've not given enough of the population the first shot of Johnson & Johnson. But if indeed it is rolled out, it will be considered first for people 60 and over and those who are immunocompromised as well.
Yes, I think we know, this is general vaccinology in all areas of vaccines that often is less effective in people who are older. Our immune systems just begin to, if you like, senesce and get old. In the same way, they don't respond as well to vaccines. So generally, when we do need to boost people, that tends to be people who are older or people who have other reasons for having reduced immunity. And so those people, I think, would be the individuals you would target first for boosting in the future.
So let's talk about the data that you're hoping to collect from this study, Prof. And I suppose top of mind would be, how long does the Johnson & Johnson COVID-19 vaccine provide protection for those who have received it? What's the information that we currently have on that score?
So we have great data up to about 5 months out. We have other data from other parts of the world up to about 8 to 9 months, showing a durable response, maybe a slight fall off in people who are older. But in terms of the impact on reducing the risk of death and severe disease, we definitely are seeing a very durable response. I think what we're hoping to see in Sisonke is we will again look at the data from the first part of the study, the whole cohort of 495,000 people, to see how does that look right up until now, and then post-boost, what is the impact for those individuals who take up the offer versus those individuals who don't. So that'll give the country and the government a good sense of what the value add is of a booster dose so that they can also organize their policy around boosting in the future.
Prof, there's also been some research around, and you'll tell me whether I'm on the right track here, around mixing up COVID-19 vaccines to perhaps provide better coverage in the long run. What can you tell us about that?
Well, I think it is the term we use is heterologous boosting. In other words, you use one vaccine to prime and then you use a different sort of vaccine to boost. And that isn't a new strategy. We've certainly been testing it and using it in other areas of infectious diseases. In this case, there are pros and cons. So the pros would be you might stir up a different kind of immunity with a different vaccine. The downside is once you've had one vaccine, you know what your side effect profile is, and you feel fairly confident that you can take a second dose and a third dose because you haven't had any bad reaction or any adverse reaction from that vaccine. So around safety, we often think that, a similar vaccine is better for that reason. You're right that data is accruing around using, say, a viral vector like the Johnson & Johnson followed by an mRNA vaccine like the Pfizer. And as I say, there are pros and cons to that. That data is still in the works and is coming through. We have more evidence for other kinds of vaccinations, such as AstraZeneca and the mRNA vaccines. But we have good data around homologous boosting of the J&J. So there was a large phase 3 study called Ensemble 2 that showed that was around a 2-dose add 26 J&J vaccine, and that certainly has shown us that is safe, efficacious, and there is good immunogenicity around doing that. So it is on that basis that we have devised the plan for a follow-up J&J boost in the Sisonke participants.
And the people who are eligible for this booster shot, they include, so it's everyone who took part in the original Sisonke study, and they include people who are pregnant and breastfeeding?
Correct. On this occasion, we have got the regulators' approval for that, based on, again, many pregnant people being vaccinated safely around the world. And so I'm delighted to say that we will be including them. It's very important we protect people who are both pregnant and breastfeeding.
So, Prof, have there been healthcare workers who took part in the original Sisonke study who perhaps have already received a Pfizer booster?
We do hear about those individuals. I don't know them personally, but we have heard that individuals have been able to do that. We are advising those individuals should not take part in the booster dose with J&J simply because we have absolutely no data on the safety of going J&J, Pfizer, J&J. And really, we feel that would not be advisable at this point. So we are asking those individuals not to step forward for a J&J boost in Sisonke 2.
And I suppose the outcomes of Sisonke 2, that's still months in the works for us to know just the benefits of having a booster shot, be it 8 or 9 months down the line.
Well, we're in a very different position today where we can vaccinate from many more sites. So we're actually hoping that we will get the boost done in the Sisonke participants by the end of the year. So actually, we hopefully will have this data very soon in the new year. Obviously, depending on whether there is another wave waiting for us in the wings. We hope not. We hope that we're taking this precautionary added protection, just as a belts and braces intention. But, if there is another wave, then we perhaps will have this data sooner rather than later, actually.
Professor Linda-Gail Bekker, let me thank you for your time this morning, for joining us on the Sisonke Booster 2 trial. She's the director of the Desmond Tutu HIV Center, also the co-national investigator of the Johnson & Johnson Sisonke study.